everyone, I am Dr. Jordan from Pinnacle Chiropractic, and we often get asked a question about what newborn adjustments look like and why babies would need to be adjusted. So this video is just to kind of show what we do during a newborn adjustment, as well as show you so you can see and feel more comfortable when you bring your child into us. So this is baby Teddy, and he has been adjusted since birth and is a well-adjusted baby, but we still like to do our routine newborn adjustment on him. So I will just show you what that looks like and show you what we're also testing. So when babies come into the office, we are always first checking their reflexes. Babies are born with about 200 primitive reflexes, and they should all integrate in the brain or go away at a certain time when the brain becomes developed enough and advanced enough to turn off some of those reflexes. And so we are always just checking little ones to make sure that those are all intact. If not, it shows us something else that's going on with them neurologically. And when also newborns come into the office, we are always starting with just really gentle finger pressure. We're only using the pressure that we would test a avocado for ripeness, or if you would push your eyelid, that amount of pressure. So we can see that it's super gentle, nothing is being popped, cracked. It is very much just finger pressure and really, really light for the babies. With newborn adjustments, we're always going to start checking the hips. Hip dysplasia is a really common thing that we see with newborns, and want to make sure that we can get a head start on if babies do suffer from that. And then it also, I know, that's so crazy. But we do some different testing to make sure we're not hearing any popping or clicking within those hips. When we are looking at a baby's spine, I always adjust as I go. So I typically start in that lower back for them in those hips and work all the way up to their neck. Babies are born they have one curve in their spine. So they are in that fetal position for 9 months. And so when they come out, they only have one curvature of their spine. And that goal for a baby's first year is to be upright and walking. Goal for year 2 is talking. So when babies have only one spine when they're born, we have to do a lot of work as parents and as doctors to help them to develop the other 2 curves in their neck and their low back. So just that fetal position is all they have. We need to develop the opposite curves in the neck and low back, which means they do need to extend and have the ability to extend. If a child comes out from a rough delivery, a long delivery, C-section, more interventions, we often see that they have more tension within their body. They're also going to have a harder time doing physiological motions that a baby should be able to do. We typically will see that there is some sort of muscle imbalance left and right, or a lack of coordination left and right, something that's causing them to have more tension within their spine and that dural sac around the spine. So typically when we first see a baby as a chiropractor, we are always checking for someone's alignment, whether that's in their face or their back. Typically we will often see babies that come and they only lay in one direction. So they almost have a C-shaped appearance to them. And that shows us that there is some tension and some imbalance within those muscles in their back. We often also will always make sure that the head and eyes, ears, nose are always centered on the face, that we're seeing equal creases in the sides of the neck on a baby. And that everything else looks centered as well. Your cranial bones within your head, and I will adjust that as I get there, but the cranial bones within your head move a lot during a vaginal birth. And so as that molding occurs and as those plates in the head shift underneath and over one another, they have to come back out, and so the brain can develop and grow. When we see misalignments, it often comes from those cranial bones not being aligned and having more tension going on there, which then is going to cause some issues with CSF flow as well. So as we're adjusting, we're just moving up the back, and I'm basically looking for areas of the spine that aren't moving the way that they should, or they're not moving with ease. And so we always just want every area, every joint of the spine to be able to move the proper way that it should. And it should be easy for the body. There should not be any tension for a little baby. But often, very often, babies are born from more of a traumatic birth, and even a perfect, beautiful water home birth can be traumatic for baby. If you can picture a baby being head down in that birth canal, every contraction that mom has before she is fully 10 centimeters dilated, baby's head is being pushed down into a closed cervix. So every single contraction, if you've been pregnant and been in labor, you know how intense those contractions are, and that contraction is pushing their head every single time. And so we know with babies, their head and neck is a very susceptible area to trauma, to being hurt, to being damaged. And so we always want to protect that head and neck. but even a really great vaginal birth can be traumatic. And then when we talk about exactly really long labors or even very, very fast labors, if we talk about vacuum, you can imagine the forces needed to use a vacuum or a forceps extraction for a baby. And then when we get to things like C-section, emergency or not, typically babies are lifted out via C-section by their head and neck or underneath their shoulder blades. So they'll kind of compress these shoulder blades and pick them up underneath here. We typically see a lot of babies that will be born via cesarean and then have a lot of issues with reflux and or colic. And so we can find a pattern there between some areas of tension in that scapular region for them, where all of their nerves that are helping them to digest food and keep food down are actually being insulted and aggravated, and so they're spitting up as a result of that. So it's pretty common for us to see some tension right between those shoulder blades with a lot of babies. I know it. The mama. And so then as we continue on, we will check the head and neck last. This is an area where babies tend to maybe get a little bit more upset if they do not have great motion. A lot of babies you will see have some issues with something like torticollis, or even just a breastfeeding side preference. And so there can be a lot of tension that results in this upper head and neck, and a lot of babies do not have equal motion to rotate and turn their head and extend their head equally on all of the sides, which is going to lead us to a lot of problems, huh? Yeah, you're so cute. So adjustments up in the top of the neck also are very gentle, just the same as before. I'm just using my fingertip pressure. Still no popping or cracking, nothing like an adult adjustment. I know you're sweet boy. And so we can also check all of these cranial bones now that we're working on the face and see, is that funny? The sphenoid bone on his right side is a little bit stuck, and so just getting some more motion in here. Sweet thing. Okay. Another thing that we will do on every first adjustment for a newborn baby is check their mouths for any kind of internal ties they have going on. So these are called tethered oral tissues, but we can all have lip and tongue ties, and those ties are within our mouth, but they connect our body all the way to our toes. And so we'll see often that a lot of babies have tension that's not able to be released without having some kind of work done to those intraoral ties. And so when we do this, we're looking just to see if they have anything going on by moving their lip up, and sometimes we get mad. Yeah, good job. And then we always check under the tongue to see if they have a tongue tie as well. And while we do not diagnose anything, we work really well with a lot of other local doctors. And so whether it's a pediatric dentist or an airway dentist, we are checking that suck reflex, we're checking those ties and making sure that they don't need referrals out or to be referred anywhere to help them better. Good job. That being said, we can do more based on baby's tolerance if we need to do anything else. Oftentimes you will see us lay baby in this nice pillow on their tummy. Make sure they can tolerate tummy time. Make sure that they're not too tight. A lot of moms will say that their babies are very strong and can hold their head up from the get-go, from day 1, day 2. And that's not something we want to hear. It's a red flag to us almost. And so we can see for ourselves if baby is a couple days old coming here and is already holding their head up on their own, that would be cause for concern for us. We can also check things like their palate within this back here in the sacral area. We can see if there's a curvature there that we would always look for if we can take that diaper off and look. We can also just see visually as well if we do that adjustment, if they're still curving to one side or another, or if they've straightened out a little bit, and we can get some more lumbar extension here as well if we need to. And then, almost done. The last thing you will always see us end a very newborn adjustment with is extension. So we want to make sure that we can extend that body and that their body can do this, where we can see them ending with, yay, the ability to straighten and lengthen that neck and low back, and so that they're really getting the proper motion in those areas of the spine and that they're able to do so. So that's pretty much all of the newborn adjustment, I think. Can't wait to meet you at our office.